Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I am a certified hand therapist. And in today's video, this is going to be part 2 of our updated Dupuytren series. The last part, if you missed it, is going to be posted in the description below. It was all about what Dupuytren's is and some of the symptoms that you might experience as well as the phases. So if you missed that, definitely check it out. Today's video is going to be focused more on treatment, self-management strategies that you can do to help with your Dupuytren's disease. There are 4 basic principles of self-management that I consider important in managing Dupuytren's disease from a therapy standpoint, from a hand therapy standpoint. The first is modify activities. The second is manage inflammation. The third is maintain mobility. And then the fourth is monitor for changes. So all M's, hopefully that makes it easy to remember. Thinking of the first tenement, that is probably the most important in activities and being functional with daily life. So unfortunately, you can't stop the process or the natural progression of Dupuytren's disease, but you want to modify your activities to avoid making the symptoms feel worse and to help you continue to be able to participate in your daily activities. So a lot of that includes, avoiding repetitive sustained gripping. So you probably don't want to go out and buy yourself a grip trainer and do a bunch of grip strengthening. We do lots of gripping as humans every day, just with normal functional activity. The strength is not typically an issue here. So strengthening is probably just causing more friction and inflammation of your tissues. Putting resistance into the tissues may actually cause worsening of the symptoms. So I would avoid, tight, repetitive gripping types of activities. If you need to do gripping for a long period of time, try and make the object a little bit thicker. Build up the handle of tools if you need to, or make things a little easier to grip so you don't have to squeeze on them so tightly. Use bigger and stronger joints. So instead of carrying like your grocery bags in your hand, maybe you can use your elbow or your shoulder, the joints that are a little bit bigger, the muscles that are a little bit bigger, to do that activity. So those are some examples of how you can modify activities to make things a little bit easier for you. Another idea is for like pots and pans, instead of lifting the heavy cast iron pan. I know you guys are out there. I hear it every day. People are like, oh yes, I have this really heavy cast iron pan that I can't lift anymore. I get it. I totally understand. Use an oven mitt, right? Like get an oven mitt on your other hand so that you can lift under the handle and lift under the pot. It's going to make it much easier for you. So all those little simple things that you can do, changing your habits, can make a big difference in your ability to function and the decrease in your symptoms. The second principle of self-management is managing inflammation. So luckily for most people, Dupuytren's does not seem to cause a lot of pain. However, inflammation can occur and that can be a source of pain. So it does help oftentimes to use an ice pack 2 to 3 times a day for 10 to 15 minutes. Make sure that you're checking your skin frequently, especially if you have some sensory disturbances like numbness or tingling, those types of paresthesias that make it difficult for you to tell if you're harming your tissue. So just make sure you're checking your skin frequently. But managing the inflammation can be a helpful way to manage any pain that you might be having. The next principle is to maintain mobility. So obviously, you can't stop the clock if your Dupuytren's is progressing. There's not really a way for you to reverse that. But you want to keep your joints moving, keep the tissues gliding, help lubricate the joints, all of those good things that help our body remain mobile and flexible and functional. So there are a few exercises that I would recommend. All of them should be performed gently and not to the point of pain. If you are, achieving a painful stretch with your stretching, you actually are probably causing your tissues more harm than good. You may actually end up in making the progress of your disease happen faster, so you actually might be making things much worse. So keep it really light, gentle. We're not trying to, reverse the contracture per se, because you're not going to have any power over that. You do need to keep things moving. So these are a few exercises that I would recommend. I would complete about 3 sets every day, like 3 times daily, 10 repetitions of each movement, just doing as best you can, gentle movements, no pain. It's okay to warm up a little before, so if you use a hot pack or a heating pad or a warm shower or whatever you want to use. The first exercise is a finger spreading exercise, so just pulling the fingers open and closed, open and closed, doing that about 10 times, nice and slow, just stretching out those muscles. The next movement is going to be a tendon gliding sequence, so going from a straight fingered position to a claw or a hook position, nice and gentle, not squeezing, and then rolling into a fist, again nice and gentle as much as you can do, and then untucking those fingernails into a flat fist, and then bringing it into a platform or a duck with or without the thumb. Let's practice that one more time. So going through a claw, a fist, the flat fist with your fingernails showing, and then your little duck bill. Okay, so those are tendon gliding exercises. It does also help, so if you have the contracture starting at your PIP joint or your middle knuckle. I don't know why I'm showing you on your ring finger. Let me show you on the pinky so you can actually see what I'm doing. If your contracture is starting to happen here at the middle knuckle where your finger is starting to stay bent and you can't really straighten it out, it's okay to do a very, very gentle, let me say that again, very gentle stretch of that knuckle. That does not mean you're cranking it. That does not mean you're putting heavy pressure into the joint. Again, that is going to make your symptoms worse. That can lead to increased abnormality in the palmar fascia and the tissue. So don't do that with force, okay? Be very gentle. It's okay if you can do this pain-free to put a gentle pressure into the joint to attempt to gently stretch it to a straighter position. You're probably not going to get it to go straight, right? But just trying to stretch the tissue just a teeny bit. Very gentle, okay? The other exercise you can do if you're having some contracture happening at that middle knuckle is a DIP blocking exercise. So you're going to hold the middle knuckle to keep it still, and then you're going to try and bend the tip joint up and down very gently, just to keep the tendons gliding. Okay, keep them lengthened. If you are having more contracture at your MCP joint, the big knuckle of the hand, again, very gently, not forcefully, it's okay to gently stretch that finger, just to stretch the tissues. We're not cranking it back. We're not pushing hard. Just trying to get a little bit of stretch on the tissue. Okay. And then you can do a PIP blocking exercise where you hold that big knuckle to keep it still and you bend the middle knuckle up and down to keep the tendons gliding. Okay, so my biggest caution, and this is a disclaimer on every single one of my videos, before you start any exercise program, you should speak with your doctor or a rehabilitation professional that has seen your specific health history, your medical history, all of those things. So please do that before you start any exercise program, okay? And be very, very gentle. If any of these movements cause pain for you, you should not do them, okay? That's really important. Promise me, guys. I don't want anyone to get hurt, okay, doing stretches that they shouldn't be doing. Okay, and the fourth principle of Dupuytren's management, Dupuytren's disease self-management, is to monitor for changes in your condition. So unfortunately, this is largely a wait and see type of diagnosis. There's not a lot medically that they're going to do for you if you are just starting to have the disease happen at this time. There's not, a lot of massage therapy that will help. There's no modalities that have been shown to help with this. Evidence is very weak in terms of modalities making the disease better. Obviously, it's just not happening. Some things can help with pain, certainly, but again, I digress. It's a wait and see type of condition where you kind of have to monitor the changes and monitor your functional activity. If you're starting to notice that your finger is curling more, that you can't do activities like putting your hand into a glove or your pocket, or you're not able to do your daily activities of normal living, like getting dressed, grooming and hygiene, cooking meals, work tasks, any of those things that you might do, you can perform the tabletop test on yourself as well. So again, with the tabletop test, I'm just going to use let me use my iPad. It's right here. So if this was a table, setting your hand flat on the table and you're checking to see if you can lay your palm flat and your finger flat. If your finger is starting to, curl up, it doesn't touch the table anymore, or if your palm is unable to lay flat on the table, that is considered a positive sign, a positive test. So it might be worth checking in with your doctor at that stage to see what your options are. You want to watch for these progressions. The doctor will measure the angles of your finger and determine what the right plan of care for you will be. There are also some surgical options available. That is something that you obviously have to discuss with your doctor and your surgeon to figure out what is best for you. That's not something that I can recommend for you. I'm not a surgeon, and obviously through the internet, I don't have access to your medical history. But just to give you an idea of some of the more common options out there, they can do collagenase injections. So that's something where the doctor will inject an enzyme like Xiaflex into the cord. That helps to dissolve and break apart the cord internally. So that's a collagenase injection. You might know, if you remember the Denver Broncos Hall of Fame guy, John Elway, who Colorado shout out. He had some advertisements, I believe, with Xiaflex a few years back, so you may remember that. So the second surgery that I'm familiar with, or that tend to see in the therapy clinic, is a needle aponeurotomy. So again, the surgeon will come in, they will use a very small needle to make lots of little tiny holes in the cord, and then they'll manipulate it to break apart the cording of the tissue. So all of these things are, to help bring more movement, to help the finger straighten out. The third is a little bit more invasive. It's the fasciotomy or the fasciectomy, where they actually physically do surgery. So they'll cut into the finger and the palm. They'll actually take out or break apart the cord from internally. So those are 3 strategies of surgical interventions, which again, you need to talk about with your physician or with your surgeon. And that's something that you can certainly discuss with them. So I know that was a lot of information. Hopefully that was helpful in some way. Please leave comments below if you have questions or concerns. And please be gentle with any stretching program that you take on. Please listen to your body. If you have pain, it's not probably an appropriate thing for you to be doing. So yeah, thank you guys so much for watching. I hope this was helpful, and I'll see you in the next one.